It definitely affected where I would go or what I would order.
28-year-old Chris Bly had a very limited and bland diet. No spicy foods, no tomato-based sauces, no fun.
I was having a lot of heartburn, depending on what I had eaten. There were times when I was having a lot of reflux shortly after eating, or I wouldn't be able to keep food down that I had just eaten.
Chris was diagnosed with gastroesophageal reflux disease, or GERD.
Gastroesophageal reflux disease is a condition where fluid or contents from the stomach refluxes or regurgitates back into the esophagus. And that causes a lot of inflammation and irritation to the lower food pipe.
After trying over-the-counter and prescription medications, Chris sought the help of Dr. Edward Lynn, an Emory Crawford Long Hospital gastrointestinal surgeon. Dr. Lynn recommended a non-surgical endoscopic treatment using a recently FDA-approved device called the plicator. It is passed down the throat, and with just one suture, it instantly creates a new tissue barrier.
It's almost like a dam that you are creating. The plicator forms a ball valve using your natural tissue at the lower part of the esophagus. So that prevents fluid from the stomach from going up into the esophagus.
The procedure takes less than 30 minutes, requires only light sedation, and patients go home about an hour afterwards.
The best candidates for these procedures are those people who will respond to medications, and they just want to get off it.
Chris was a perfect candidate and says he noticed improvement right away.
I don't have to be as cautious about what I'm eating. Mexican food is no longer a problem. Pasta sauce used to be a problem before, and that's not an issue anymore.
An old favorite back on the dinner table again. For Emory, I'm Rhonda Rowland.